open enrollment for Medicare is going on right now, and it runs through December the 7th. A lot of things are changing this year when it comes to Medicare coverage. Catherine Sevier from AARP North Carolina, Steve Edmonds from Alliance Insurance Services are here with us to talk about it. All right, Steve, let's kind of just start off with some of the biggest changes you're seeing this year.
So we are seeing a lot of changes on Medicare Advantage plans this year. A couple of the primary changes is your out-of-pocket maximums may be going up, so you really need to check your plan for that this year. A second thing is your hospital copays. We're seeing those increase quite a lot for 2026. So again, you really need to look at what you have and what's out there available to determine. Thirdly, we're seeing high deductibles put on brand name medications for 2026. Generics are basically staying the same. So your generic drugs, you would not have to pay a deductible, just a copay. But on brand name drugs, you're going to first have to meet a deductible. And once you satisfy the deductible, then the copays start kicking in after that. So that's some changes for 2026 that some of us have not been accustomed to in prior years.
Okay, and so that is something that everybody needs to look at to see if their plan has changed. In fact, that kind of brings me to this, Catherine. A lot of times people say, well, I loved my coverage this year. I'm just going to keep it just as it is, and I'm not going to look around.
Yeah, and that's risky right now. Your coverage may not be the same. In fact, particularly with the Advantage plans, they may drop something that they've offered you in the past. So it's really important for you to look at your current coverage, look at your bill, see what you need from a plan, and then match that up with the plan options that are out there. So it's both price and availability and coverage based on your healthcare conditions.
Okay, so everybody needs to be looking at that, whether you're happy with what happened this year or not, because things do change. This is something that's very common. In fact, it happened to my dad, Steve. He was working and he was told, you don't need Medicare right now because you're working, so you don't need to sign up. What's the problem when you don't sign up at 65?
So you can be hit with penalties, and there's actually two different penalties. There's a Part D penalty. There's also a Part B penalty. And both of those can really add up, especially if you go a long amount of time without coverage. Now, if you're still working, a lot of times your group insurance will satisfy Medicare's definition of credible coverage, so you might be okay. But it's always best to check on that. When you turn in 65, you really need to look into that, ask questions, talk to professionals, and get some guidance on what you need to do when you turn in 65, because it could be okay, it might not be okay. It's just according to the situation.
Okay, and right now we have the graphic up of when you need to enroll in Medicare. So Catherine, go ahead and explain that while the graphic is still up.
So every person needs to have a relationship with Medicare when they turn 65. So 3 months before their 65th birthday to 3 months after their 65th birthday. So that's a 7-month period. And during that time, you need to sign up. Almost everybody is eligible and gets Part A right away. That is their hospital coverage. And then Part B will go from there. If you have credible coverage, you're great. But if you aren't and you miss that deadline, you will be faced with penalties, and they go on for the rest of your life. They are in perpetuity.
All right, and so that's when you're supposed to sign up for Medicare. If you are 65, 66, 67, you haven't signed up for Medicare yet, this is the time for them to sign up right now, Steve, is that right?
Yes, you can do that. You can do it from the open enrollment period or annual enrollment period, which runs from October 15th until December 7th. So you can sign up in that time frame. Now keep in mind, even when you sign up during that time frame, your effective date still will not be until January 1st of the upcoming year.
Yeah.
But yes, it's a great time to sign up if you've not done that. For sure.
All right, and I think we want to make sure that we tell people the bottom line is, even if you're still working or your spouse is working and you get the insurance, you still have to sign up for Medicare at 65, Catherine, because if you don't, why?
You pay a penalty and you pay it for the rest of your life, and it grows. The longer you don't sign up, the bigger the penalty. So you're going to pay for that for the rest of your life, and that can get very pricey.
All right, so maybe you don't need Medicare, but you need to sign up for Medicare at 65. No ifs, ands, or buts on that one. Thank you both for your time and your expertise. If you missed any of this or you needed to send it to someone, it's going to be in the Who Wants to Know section of our website.